bold words about me. At times we sit back and say, is he really talking about me? I would like to express my gratitude to all organizers of this webinar and to those that participated in conducting this very, very important study. As a member of the Africa Judges and Jurists Forum, the AJJF, I'd also wish to thank the Open Society Initiative of Southern Africa, or CISA, through our sister, for the support that they have extended to the AJJF for work to promote human rights in the context of the fight against COVID-19. Like Arnold said, this issue is a human rights and rule of law one, and it calls upon people like us to augment what governments are doing, to advise them, and to help encourage them to listen to us and to other like-minded groups. As the world grapples with the unprecedented COVID-19 crisis, many people and governments across the globe found themselves in many difficult and peculiar situations in efforts to contain the situation. The responses by many governments had potentially far-reaching consequences for economies, social and political lives. The priority was to save lives. And given the exceptional situation and the imperative to preserve life, many countries had no choice but to adopt extraordinary measures. In the result, extensive lockdowns were adopted to slow down the rates of transmission of the virus. Several fundamental rights were impacted and restricted, such as the right to freedom of movement and many other human rights in the process. As the Secretary General of the United Nations noted in his policy brief in April 2020, human rights are key in shaping the pandemic response, both for the public health emergency and the broader impact on people's lives and livelihoods. Human rights are inherent in every human being and should only be limited if necessary and or as may be reasonable in a democratic society. The COVID-19 pandemic should never be used as an excuse to violate rights willy-nilly, as we have seen in some jurisdictions. It is also important that any limitations that are imposed should endure for as long as it is necessary. Responses that are shaped by and respect human rights yield better outcomes in beating the pandemic, ensuring health care for everyone and preserving human dignity. It must be noted that some governments implemented emergency measures in the form of COVID-19 regulations in good faith, some of which had unforeseen or unintended consequences for people's rights. Other governments, however, may be said to have weaponized the pandemic and used emergency measures to deliberately target certain groups and repress citizens' rights. It is important to ensure that all measures to combat COVID-19 are implemented based on the law, which should be publicly available to all citizens, and that opportunities exist for these regulations and measures to be challenged in courts by aggrieved citizens. The police, and in some cases the army, were called upon to enforce compliance with the lockdown regulations. However, the enforcement of these regulations by law enforcement officials generated a lot of controversies and public outcry, as there were some violations of human rights in some countries in the region. Some governments passed restrictive laws, such as overly broad emergency laws, under the guise of fighting the pandemic. Citizens, journalists, and human rights defenders experienced harassment and intimidation. International human rights law recognizes that in the context of officially proclaimed public emergencies, including in public health, which threaten the life of a nation, restrictions on some rights can be justified. Those limitations, however, need to comply with international standards. While international law is clear on the limitations, some states have gone beyond justifiable restrictions with negative consequences on civic space and human rights, while also creating additional barriers for already excluded groups. From censoring citizens due to the alleged spread of fake news on the pandemic, to targeting media outlets and detaining journalists. We see this happening almost all the time. In some countries, freedom of expression has continuously come under attack during the pandemic. Journalists were arrested and charged with spreading fake news. And this was particularly concerning given the importance of having access to accurate information and the crucial role of journalists and the media during the pandemic. With the pandemic, many excluded groups have faced additional risks and violations. While the lockdown measures could have contributed significantly to limiting the spread of the pandemic, they also have caused significant damage to regional economies, which has impacted most on the poorest and most vulnerable sections of society, including women, persons living with disabilities, children, and migrant populations, among others. Even before the pandemic, large sections of the SADC population lived below the poverty line, with severe challenges in accessing employment, adequate food, quality health care, quality education, and adequate shelter. This had adverse ramifications for the enjoyment of socio-economic rights of the majority of the people in the region. Like other parts of sub-Saharan Africa, Southern Africa posted some of the worst social indices globally. This situation was only made worse, or much worse, by the pandemic. Dear colleagues, as I conclude, I would like to thank the Secretariat of the African Judges and Jurists Forum for having undertaken this study. To you, our participants at this webinar, I wish all of us fruitful deliberations and hope that conversations such as these can help to catalyze a convergence of ideas that will be used to improve the state of human rights in our region. And finally, I thank the forum for having invited me to share these few thoughts with you. I thank you.